I am super excited about the next talk that we have coming in. So Jacob Peters has braved crutches to be here with us this evening, which is very exciting. Go, Jacob. So Jacob is first and foremost a friend. Secondly, he's also the founder of Superpower. How many of you have heard of Superpower? Bunch. Leslie works at TrueMed, so she's definitely heard. So what basically they're doing, well, I'll let Jacob introduce himself, but they've raised tens of millions of dollars, have hundreds of thousands of users, like have just built one of the preeminent companies in this sort of like health span, longevity, and wellness world. And so I've always admired Jacob as someone that sort of has this uncanny ability to see around corners and get a sense of like what is coming. I think you were the first person to ever tell me that peptides would be a thing like 4 or 5 years ago. And look at the moment we have ourselves in right now. And so Jacob is going to be giving a talk about peptides and sort of other things that are happening at the frontier of regenerative medicine. So Jacob, stoked to have you.
Thanks, Justin. So you're probably all wondering about the crutches. I wish I had a more legendary story, like I on a BPC 157 needle or something. But the truth is I was discovering barefoot running like 4 months ago. And turns out I have 2 abnormally fused bones in my feet. So 4 months of pounding the pavement with little to no arch support can give you a stress fracture. But thankfully there's a peptide for that. So today we're going to talk about peptides and other frontier regenerative medicine compounds. So I think the prior talk, it was a bit alluded that I had a crazy health situation a number of years ago that catalyzed my interest in this space. So peptides were actually a really important part of my healing journey, and I say they did save my life in a way. And they also got me banned from Reddit, which we'll get into in a moment. So a little over 4 years ago, an autoimmune disorder called Crohn's colitis that many are probably familiar with almost took my life. And I spent close to 9 months in the hospital. I never once was given any root cause protocol or intervention or test that helped me get to the root of what was happening. Instead, all that was offered to me was pharmaceuticals or surgery. And it led to me getting stuck with a multi-million-dollar bill. I lost a big portion of my life. But the saving grace was after this whole traumatic experience, I ended up discovering concierge longevity medicine, where I got connected to a handful of physicians on the frontier that use interventions like peptides that spend 6 hours with you on a whiteboard, connect the dots across everything in your health, leave no stone unturned as far as testing and diagnostics go. And that's ultimately what helped me turn the corner. And I turned all of this into a protocol and treated my body and health as, I guess, what you call an N of 1 science experiment. And a lot of my protocols, I've open sourced them. I used to share them on Reddit because when I was going through my health situation, I joined a bunch of these communities for Crohn's colitis, and I actually got banned from various subreddits because they said that many of my protocols included things like peptides and oral BPC 157, which allegedly don't have enough evidence, and I was scamming people on the subreddit according to the mods. So this was a few years ago before I think some of this was a bit commonplace, and I also decided to channel this into a company, which Justin alluded to. So 3.5 years ago, we started Superpower, which is now one of America's fastest growing consumer health platforms, and we make it really easy to get full body lab testing and access to any intervention like peptides that you can take control of your health. This is the wrong subtitle, but as part of the story, beyond healing myself, something I did is I went really deep on the history of medicine and incentives behind how this industry works. And I came across this book, which was really transformative in my understanding of this space, and it's called The Social Transformation of American Medicine by Paul Starr. And it posits that there are 3 arcs in the history of medicine in America. The first arc, you could say this was from the early 1700s to call it about 1860, 1870, around the Civil War. And that was a story of health sovereignty, natural healing, and personalization. So this is when every person pretty much had a local physician that knew them very well. There wasn't institutionalized medicine. Many of the protocols when you had a sickness or an illness were herbal-based, natural remedies, and people were given books like this in their one-room schoolhouses, which were sort of like how-to manuals on how to take care of your body. The second arc was in the late 1800s, kicked off by the idea that anyone could start their own institutional medical school, and medicine started to become commercialized. Medical boards formed. Around World War II, the healthcare in America got tethered to your employer. In the late 1970s and 80s, healthcare started becoming really big and institutionalized with the birth of large health systems, private equity-backed backed physician groups, pharma companies. We all know the story. And medicine became one size fits all based on population health. And for the first time ever, we were actually engineering biology and creating man-made artificial compounds that we could use to treat disease and have effects on the body. The third arc, as Paul Starr posits, is actually beginning now, right around the time that ChatGPT came out, the pandemic, and it's this idea of a return to sovereignty, where we have an explosion of direct-to-consumer therapeutics. It's really easy to get labs tested, your genomic sequence for just a few $100s, any type of prescription that you want from the click of a button without a doctor as a gatekeeper. And we have LLMs and AI doctors which allow any of us to have our health in our pocket and really make sense of what's going on. And what's really interesting about this third arc of sovereignty and a return to sovereignty and peptides is that peptides sort of are collapsing the gap between these two, because for the first time ever, we have molecules that are natural in nature. So these are signaling compounds, which we'll go into in a little bit, that mimic processes that the body is already doing. And you're able to get these compounds, as we'll touch on in a little bit, without having them be gatekept by the institutionalization of medicine. And we're able to build on the manufacturing innovations that produce the pharmaceutical industry to bring these things to consumers at scale. So what are peptides exactly, as we enter this third arc, with peptides being sort of, canonically the thing that closes the gap between sovereignty and institutionalized medicine? Well, they're effectively, as I said, ways for the body to signal certain processes to kickstart. And if we think about our bodies as like full stack organisms, DNA exists at the most base level. It's sort of like the source code that brings our biology into existence. DNA encodes RNA, RNA encodes peptides and proteins. Those signal cells perform certain functions which create tissues, which create organs, which ultimately make up us. And that's very antithetical to some of the, I guess, institutionalized approaches to creating compounds over the last 50, 60, 70, 80 years, where synthetic molecules like small molecules or biologic drugs are things that I guess resemble more like crowbars, where they're either like blocking or stopping biology oftentimes versus signaling natural processes to kick off. And so how are peptides actually created and manufactured? I spent a lot of time in the last few years going deep on the supply chain, touring scores of compounding pharmacies, talking to suppliers overseas, and it's a really interesting process. So 95% of peptides in the world are created in Korea, India, or China. And the way that it works is there are these chemical manufacturing facilities that are actually creating raw amino acids. They send those to peptide synthesis plants, which chain the amino acids together through like really intense chemical processes that are really hard to justify being done in the United States because the EPA has a lot of regulations and these things produce a lot of chemical byproduct and pollution. And then those raw materials called applied pharmaceutical ingredients or active pharmaceutical ingredients get sent to compounding pharmacies, which are like FDA registered manufacturing facilities in the United States to ultimately turn those into pharmaceutical grade compounds. And there's sort of been like a bifurcation of manufacturing of peptides that have emerged, one of which is the regulated path. So these are like 503A and 503B FDA regulated compounding facilities in the United States. The other are gray market facilities, which are technically not able to exist, but they've popped up very ubiquitously across the US, as we'll go into. And something that I've also kept an eye on is this like emerging trend of new synthesis methods. So there's been like a few $100 million of biotech venture invested in new methods that can make synthesis much cheaper. So I've seen everything from like growing peptides on egg whites to fermenting bacteria and harvesting the peptides from that, to growing live insects like cockroaches and extracting and harvesting peptides from those that could potentially be much less environmentally toxic and much cheaper than traditional peptide synthesis methods. So something to note here is like the cost curve is going to come down and peptides are going to get much more accessibly priced and easier to make and potentially onshore manufactured in the US versus being done overseas as new methods emerge. I think most obvious thing here though is that if peptides are naturally signaling molecules, it's important to understand that your body's also a peptide factory. So like it's creating peptides which tell your body to perform certain functions every few seconds. And this whole industry is not new. It's actually been around for almost a century. So insulin was like one of the first therapeutic peptides that was really discovered and commercialized. I think we all have a sense of what that is. And only in the last 15, 20 years was there a major breakthrough commercial application, which is now GLP-1s. But there's actually thousands of peptides that we've discovered. We just haven't really done the research or found ways to properly commercialize them. So the first breakout was insulin, and GLP-1s were the next to follow. So it's kind of interesting to think that like the biggest breakout drug of the century, which so far is GLP-1s, is one that we already make versus a man-made compound. And the market for this is actually really delusionally large. So something that I read recently is Eli this year from GLP-1s alone is going to do more revenue than all of AI applications like Claude and Anthropic combined, which is pretty ridiculous. So there's, again, this much revenue and money and market opportunity from just one molecule and one receptor. And there's thousands yet to be discovered. So I think we're just at the beginning of what's going to be a Cambrian explosion of applications of this type of compound that we can bring to more people. But there's some challenges with bringing scaled innovation to peptides beyond the ones that have already been commercialized, and that's because of some, I guess, fundamentals of how the pharmaceutical industry works. So it's really hard to patent a lot of these compounds, which is the business model of pharma and why many of them have to discover and engineer these like alien molecules that were not compatible with our natural biology. So the way that many of these companies have gotten around this is they've done things like patent the delivery mechanisms for therapeutics like GLP-1s. Or there's a big fight right now with Lilly and Novo trying to classify certain peptides as biologic drugs, which fall under different regulatory frameworks than peptides themselves. So this is one of the challenges in the space. Time like there's a lack of incentive to invest or own or like protect IP, that's going to stimulate or change innovation. That also affects the peptide industry upstream in the academic world. So oftentimes a lot of academics who want to research these types of compounds within academia, there's no real incentive for them to do so because there's no way that the university can ultimately capture downstream monetization of that if there's no IP protection. Or oftentimes, again, because this industry is a bit new and frontier, these academics can kind of get seen as like the black sheep within their research work, and it's really hard to push research forward. So as a function of all of this, there's a handful of peptides that we probably all heard about at this point, things like BPC, TB500. Traditionally, these were legally able to be compounded and produced in the United States by pharmacies. And about 2023, so a little over 3.5 years ago, there was a big lobbying effort done by the pharmaceutical industry where they changed the classification on the way that the FDA approves or disapproves drugs to be able to be compounded for various peptides that are like non-GLP-1 focused, so things that heal like tissue repair and other mechanisms like BPC. So the pharma companies effectively made a really big push to effectively make it illegal for these things to be created because some of them see it as a existential threat to their industry. And with the new administration, there's been a lot of talk over how can we lessen the regulation and open up innovation for this class of molecules that might be really effective, even though the research is a bit gray. And so as a result of these peptides being banned, there's been like a Cambrian explosion of, I guess, what I call the econ bros entering the space. So there's thousands of what are called now like research use only peptide brands that have popped onto the internet. So these are e-commerce sites where people are selling access to catalogs of like the hundreds to not quite 1,000, but there's definitely a few hundred of peptides which are, again, different than GLP-1s, but have a variety of functions for longevity, skin repair, things that like are even hard to claim because we don't quite know what they do because the research doesn't exactly exist. But there's become, I guess, like a memification of peptides in popular culture, and people are really excited about the possibility of what these compounds can do. And there's clearly a lot of demand given how much they've exploded. Something that I think a lot about and is kind of like a core thesis that underpins the platform that we built at Superpower, because our mission is to enhance and extend human life is this like broader idea of enhancement. So although we don't quite know exactly what all of these compounds do, which ones will ultimately end up being safe or effective, the thing that I always come back to is that I think whether it's peptides or other frontier compounds, there's going to become this idea that enhancement becomes a biological imperative. And we shift to a world where if you're not enhancing, there's like a Darwinistic effect at play where you're going to get left behind relative to your peers, either on your team, at your company, in your community, or just in the broader culture that are not taking advantage of frontier therapeutics and compounds to help advance their IQ, improve their metabolic health, or other things that might separate us from other people in our capitalistic world. So something we get asked all the time as we look to make a big push into peptides and superpowers, what are some of the popular peptides and what they enhance? And I recognize this is a bit small because I see some people squinting. But for those who aren't as familiar about the space, there's like typically 5 main categories of what the most popular peptides promote to help. And that's things like repair, growth for muscle, metabolic improvement, so weight loss, and insulin sensitivity, skin health, and cognition. This is my personal list of what I think will be some of the hottest peptides of 2027 based on where I see the puck going. One of those is SS31, which is an enhancer for mitochondrial protection. So this actually protects mitochondria from reactive oxygen species. Andrew Huberman recently talked about this one on a podcast and said that he thinks it's going to be really big as well. FLGR422 is a really interesting one. So who here has heard of MiniCircle? Or, okay, there we go, a few folks. Well, it's a company that promotes experimental gene therapies for things like myostatin inhibition, which help promote muscle growth. So there's a peptide now that actually acts on a similar type of pathway that has started to become very up and coming in the bodybuilding space. And it's quite meaningful, the at least anecdotal results that people are seeing as far as muscle gain. And then another one is delta sleep-inducing peptide and epitalon, which I'm personally experimenting with, and I have the Oura Ring data to prove that it's actually become really meaningful on my HRV. This is my personal stack. I can send this out after the fact, so I have a big spreadsheet of like 200 different compounds that I've cycled and tried over the last few months, and I take BPC and TB 500 and KPV for repairing tissue, which is very pertinent for my current tendon and bone injury, and then MOTS-C, SS31, humanin, which are helpful for mitochondria, which personally, and we'll get into this in a second, have anecdotally dramatically improved my energy levels. And from first principles, these things make sense, right? There's 33 trillion cells in the body. Each cell has scores of mitochondria, and these compounds act on the little motors of the mitochondria that keep all those cells running and producing energy. A lot of these peptides are actually FDA approved for other use cases. So like SS31, as an example, it's called elaparamide is the other name. It's approved for renal failure. And there's a lot of, I guess, understanding in those types of cases that when you have local organ failure, it's a mitochondrial problem or a mitochondrial dysfunction. So if it works in one organ system for one condition, it probably works on all organ systems because every organ has mitochondria in the cells that make it up. And I wanted to touch on this idea that, like, although a lot of these compounds are still experimental, there's not much evidence, there's this, I guess, trope and concept in medicine that I think about, which is that before there's evidence, there's often anecdote. And then anecdote becomes, I guess, the meme that moves through society, which ultimately spurs capital and excitement and research into the space. And something that we're doing at Superpower is, as we start to roll out access to many of these compounds over the summer as the regulations change, every member is going to get access to their own N-of-1 clinical trial through the platform, because we have the first ever what we call closed feedback loop in healthcare, where we connect clinical outcomes, which is all of your data that we can measure, to clinical interventions and all the things we get you access to, like peptides. We can start to collect real scale or large scale aggregate data on how these compounds might be affecting humanity. And it's, I think helpful to touch on that there might be risks. There's a lot of unknowns with many of these compounds, but the reality is I think, number one killer in America is not heroin overdoses, car accidents, or gun deaths. It's actually medical errors or things that the healthcare system perpetuates. So there will be positives and there will be negatives. It's also important to, I think, cement that like peptides aren't really a panacea as far as compounds improving our health. I think they're just like one tool in a broader toolkit. And where the future of medicine is going, and the big bet that we're making, is that we see a future where AI systems are able to ingest the full spectrum of what's going on with you. So everything down to the genomic and proteomic level, your health history, your blood work, your lifestyle preferences, comparing that with the database of what therapeutics exists, which might be a combination of peptides, other regenerative compounds, existing mass scale population pharma drugs and nutraceuticals and supplements, and then dose custom protocols to you in one syringe or one powder or one pill, all done through like a vertically integrated biomanufacturing facility, which is how we see the future of medicine going. So peptides just become like one part of the equation. And something I wanted to touch on beyond peptides is this broader idea of regenerative medicine and regenerative compounds. So peptides are classified under this category because, again, they're not something that humans have precisely engineered that's foreign to our evolved biology. They're these like signaling molecules that the body already produces, which is why we call it regenerative, because it's things that cause the body to spur different processes. And there's a handful of other, I guess, compounds that I've experimented with personally that fall on this spectrum that I think are going to be much more talked about and researched and commercialized in the next few years, and that's bioregulators, which are special classes of, some say they're peptides, some say they're not. It's kind of a bit of a research debate right now, but they're like ultra short peptides that are 2 to 3 to 4 amino acids long, and unlike traditional peptides, they actually act on the epigenetic switches of our cell machinery. Exosomes, stem cells, things like natural killer cells, which can help boost our immune system. So I was recently in Lithuania getting a handful of these treatments done, and they extracted all of my natural killer cells from my blood, sent them to a biomanufacturing facility, multiplied them by the billions, and I'm going to get them re-injected back in so that I can improve the amount of, I guess, natural killer cells that my immune system has to help fight off latent viruses, which are a whole nother rabbit hole and a half that we could spend 30 minutes on. So that's my musings on the peptide space, where I see it going, and welcome to Act, I guess, Arc 3 of medicine.
Anyone have questions?
So thank you so much for the work you're doing. I think it's really important. Also, it's unfortunate that right now there isn't a middle space between institutionalized medicine and anecdote. Along those lines, I think one of the criticisms is that peptides just aren't ready for prime time. And should we really be advocating them when we don't really know the risks? I'm referring specifically to potential uncontrolled cancer growth with muscle stimulating peptides in particular. There's real reason, as you know, to think that it does accelerate existing cancers.
Was that a statement or a question?
Oh, sorry,
Yeah.
both. I'm interested in your response to that. Like, should we not wait to see if it causes uncontrolled cancer growth before experimenting on ourselves?
Yeah, it's a great question. I mean, it reminds me a lot of like the debate over advanced imaging and advanced diagnostics, which is one that we've been fighting over the last few years, trying to democratize access to things that are typically gate-kept behind the pen of a physician for approval, but now anyone can order their own full-body MRI or get access to lab testing or genomics. And like, should you be able to see what's happening in your body without access to a genetic counselor? Or are you going to accidentally uncover incidentalomas or things that might require some degree of secondary advanced imaging and could potentially cause more problems than you started with if there was something that wasn't really a problem and you ended up going surgery to biopsy? So I think it's a similar type of type of debate. I think the reality is whether there's safety data to be fleshed out or not, I think people are not going to stop wanting to experiment and try the frontier. I think our view is like we're not going to be pushing things on people as much as we're going to give them the tools to make their own decision. There's, I think, no shortage of supplements or other compounds today that can cause problems with liver toxicity or other challenges within the body if taken improperly or taken for the wrong, I guess, genetic profile or the wrong profile of your existing biology. So I think our whole ethos is just give people access and choice. They can ultimately decide for themselves. And with, I think, the system that we're creating at Superpower, we have a research loop which ultimately will help get answers as a medical community to these types of questions, because the data just doesn't exist today.
Awesome, thank you. I have two questions. The longer one is, I love the fact that you're creating a research loop and that you're collecting this data. By definition, you've moved from the controlled trial into the Bayesian studies kind of space, because it's all an agglomeration of anecdotes. All these studies of one. Are you guys thinking about how do you set your priors for each of these, like, conditions, or what's this peptide going to do? What's our guess of what it's going to do in the place where your participants, your subjects, are self-selecting? Like, sort of how, are you guys in that research space, or are you like, hey, we're just going to collect the data and let somebody else figure this out?
Yeah, it's a really great question. So, I mean, it has to start with the data collection. And that's like, I think every company starts with what they're really good at and has an area of expertise. And that's our MO. As far as, like, I think pulling some of the best practices for what makes, like, real trials successful and publishable, that's something we haven't exactly taken a stance on yet. But for now, like, what's important is just making it really frictionless to gather the data.
And my second question, are you guys doing anything in Montana?
Why do you ask about Montana?
They have a new right to try law. And
Okay.
they're setting up sort of IRB systems and things like that of people going there and trying whatever they try as long as the data is collected.
Yeah, there's a lot of states that are investing in these, I think, new types of paradigms. So Utah and Florida actually just lessened the legal restrictions around stem cells. So there's a handful of clinics that I'm aware of which are already setting up shop in those states, and there might be federal regulation soon to follow. So yeah, it's interesting to see states moving ahead of the full federal regime, which we saw in other markets like cannabis, but it's now happening in medicine.
Thanks so much for the talk. Why has no one really done a phase 1 or 2 trial on some of the most common peptides? How much money would it take to do those?
It's expensive. So one, it could cost millions. Two, again, it's not patentable, really, because these are compounds that the body already creates naturally. That being said, there are ways to create IP in the space, which we've looked into. So those is, like, you can add different, I guess, like molecular adjuncts to various types of peptides, which theoretically could be patentable. So, like, there's, like, companies working on BPC 157 patents that I've seen come across my desk. So it's now becoming a thing, but historically there wasn't much there.
And given the government push towards, say, the unban of these peptides, it seems like even though it's millions of dollars, it's not that much money compared to what is currently spent in any healthcare budget. It seems like there's a dissonance between the push towards these, but also not spending the money to do the real work on the clinical trial side.
I think there's a lot of money in these things. I mean, just look at GLP-1s alone. 1 in 4 Americans have tried these, and it's just one molecule of what could theoretically be thousands that act on different aspects of the body. Now, it's the most, I think, visible and disease-causing metabolic health and weight gain. But yeah, it'll be really interesting to see where the consumer interest flows relative to everything else.
Cool. Thanks.
Could you talk a little bit about where you see sports going in the era of peptides, given you had a slide and enhanced up there? I mean, I've personally also tried MOTS-y, and I play soccer very competitively, and it has notable effects. So can you talk about that?
Yeah, on the MOTS-y and the SS31. So we've probably over the last few years gotten in touch with the top 20 or so frontier longevity and functional medicine doctors in the world. And I was talking to one, this was like three or 4 weeks ago, and he told me that anecdotally of all the peptides he's prescribed at his clinic, SS31 and MOTS-y are the most refilled. And he's like, your indication there, again, because before there's evidence and research, there's anecdote, is people feel the effects and they want to keep refilling it and doing it. But sports are an interesting one. I'm sure people here have heard of the enhanced games. Raise your hand if you have. Yeah, okay. So this is, I think, a harbinger of what's to come. We'll see. I think there's going to be like a very large ongoing debate in professional committees as to what constitutes performance enhancing versus isn't. Like, is a peptide really that much different than certain types of supplements? It's debatable. So we'll see. Some of them, interestingly, are not, I guess, like measurable. We don't really have good telemetry to be able to understand if people are using them or not. So I've heard off the record a handful of professional athletes that I know in my circles who are using a lot of frontier compounds that are undetectable. So again, I think it goes back to this like Darwinistic imperative. Like, if you're an athlete and you're not using these compounds and they're not detectable or they are legal, you're theoretically going to get left behind relative to your peers that are.
So I've got a question about delivery mechanisms, because injecting stuff I got off the internet is beyond where I'm comfortable getting. Yeah. And they've seemed to figure that out. They seem to figure that out for GLP-1s, right, where you can take it as a... Is there any kind of solutions out there that will make it oral for these chemicals instead of injectable, or any kind of research like that you're familiar
with? So there's like I think 5 or 6 ways that I know of to take these compounds. There's injectable, and again, the reason is that like these are unstable molecular chains like multiple amino acids, so stomach acid degradation is a real challenge. 2 is the oral, besides injectable. 3 is I've seen patches, although I guess the actual delivery of those, how they work in getting it into the bloodstream is very debated. Nasal works for a few, and I think there's going to be some big innovations coming soon in the nasal delivery of peptides. And then another is troche, which is like sublingual, under the tongue based, which gets absorbed a little bit differently than the gut. So I do think we're going to see lots of innovation in delivery mechanisms, because injecting kind of sucks, but at the same time, 1 in 4 Americans have tried an injection. And if you polled this room 10 years ago, I bet maybe 1 or 2 would raise their hand and say they're comfortable injecting. Now I'd say it's at least 20 to 30%. So the times are changing. Consumer sentiment is shifting. Yeah.
Are there any known negative case studies for any peptides, or is it all positive?
I don't think there's any like ubiquitously positive case study for any compound. There's probably always at least one negative case study. Or
but like, are there any specific peptides that you would recommend against using, for example?
Well, that's a good question. So one that I haven't touched as an example is melanotan, which affects like the melanin receptors in your skin, because my father had skin cancer, and I think there's just a lot of unknowns as to how that might affect people that have that proclivity, back to the cancer question from earlier. So that's one as an example, but again, there's just a lot we don't know. Okay, two more questions.
Yes.
I'm getting signaled.
Are you familiar with Combo, the plant medicine?
With what?
Combo, Kambo.
I'm not.
Okay.
Is anyone here familiar with Combo? One person. Okay. Yeah. 2 people.
It's been practiced for like potentially thousands of years, but it's not psychoactive, but it is a substance from the Amazon that's taken from a poisonous frog. It's been discussed in the last year as one of the only substances to have like basically 16 peptides inside of one compound, and it's applied in a specific technique that causes like a massive detox. And a lot of the practitioners who follow that tradition basically say that when you're delivering peptides, you should actually be delivering like 15 to 16 at once, because they could work together polymolecularly and kind of offset the side effects of one with the other. And it's, long COVID has been something that's been solved by it. I personally, just like you, had like a bunch of autoimmune conditions and found massive benefits from it. So I'm just curious if it makes sense to you logically that you might want to intake multiple peptides at once instead of just singularly.
Yeah, so this is actually exactly where we see the future going, if this slide is legible enough. So yeah, I do think the future is a combination of many types of peptides, nutraceuticals, and different compounds, all custom compounded together for people.
Okay.
Yeah.
And would you,
We just don't. The problem though is like we don't have, I think, one, like an understanding of some of the interaction effects, which we will get as a scientific community, and two, the biomanufacturing infrastructure doesn't exist. But that's something that we're working on.
Hey, awesome talk. You mentioned at the beginning that peptides saved your life. Could you speak just a little bit more about how that played out? And you also mentioned autoimmune disorder. Could peptides help with environmental allergies?
Yeah. So on the, I guess, comment that peptides were really instrumental in my healing journey and helped save my life. So I was dealing with autoimmune disease, Crohn's colitis, which is like an autoimmune manifested from many underlying challenges. So in my case, it was a lot of things like heavy metal mercury toxicity. I had a mercury level of like 34. Intestinal permeability, which is when your gut lining develops like microperforations in it, and endotoxins and food particles leach through. Oftentimes, a lot of allergic reactions are actually a result of food particles or things that shouldn't be leaching through your stomach lining into the rest of the bloodstream, getting picked up by the immune system, and then causing that reaction when you ingest the particle. Third is I had like a really dysfunctional nervous system. 4, my nutrient balances were super low. 5, my microbiome was extremely dysbiotic. So all these different types of challenges, I solved them with discrete interventions. And I think one of the most needle moving for intestinal permeability, as an example, was oral BPC 157, which is one of the peptides that can be survived through the stomach acid and is able to coat the endothelial layer and lining of your gut to help it heal. So that's an example of one. Another on the immune side is thymosin alpha 1, which helps your thymus work better and regulate like your T cells, which can oftentimes become a bit imbalanced when you're dealing with autoimmune. Okay.
All right. Thank you, Jacob.
Thanks, guys.
Appreciate it. All right, that's all we got today, gang. Thanks everyone for up. Jacob, thank you again. That was amazing. So we're gonna be back here tomorrow, probably around 4:30, to meet up, and we have a bunch more really interesting talks tomorrow, including one guy, Andy, talking about home health, mold, EMF, some of these other things. Another guy, RJ, who you may know as Anabology on Twitter, talking about longevity and bioelectricity and how we should stop developing drugs as like a new paradigm for health span and drug development. It should be great. So we'll see you all tomorrow. Thanks for coming through.